April the 16th. A raging inferno reigniting from the basement storeroom, flaring up and spreading to other parts of the hospital, causing the third floor to collapse. It was contained overnight and no fatalities or injuries were reported. With the hospital temporarily closed, a midweek assessment visit by authorities, it emerged almost 800 patients were transferred to 17 other health facilities.
Of that figure, we discharged 25. So these were patients, where clinicians made an assessment of whether or not they're in a condition where they could be discharged to go home, and we proceeded to do that. This is also part of just trying to alleviate pressure and just ensure that we take as less patients as possible. But of course, it's a bit of a low number. So we then transferred those patients to various facilities across the province in Gauteng. Nelson Mandela Children's Hospital was one of those facilities, and thankfully it's quite close by. The neonatal ward kind of shifted to that area as well, so which was quite key. Some services have shifted to Chris Hanipara, Steve Biko Academic Hospital, Sterkfontein for mental health care users as well, Tara Hospital, Edenvale. So really they're spread out across all the facilities.
And assurance to patients' families.
The engagements with loved ones of the patients is ongoing. That process started on Saturday through our provincial hotline team that has been also making calls to loved ones, but also receiving calls from loved ones. One of the things now that we're starting to manage, and as I had a conversation with you earlier, is just about updating people with regards to where do they get services that they had previously were getting from Charlotte Maxeke. So the hotline is also dealing with some of those things, but of course the issues we communicated earlier on in the morning around gynae surgery and gynae clinics, that service is shifted to South Rand Hospital. And of course the hospital has made a commitment that they will be engaging people directly with regards to making appointments as well. The planned C-sections as well the coordination will be starting from the Discoverer CHC in the west of Johannesburg there. So those are some of the developments, but of course we are shifting services, and as and when we have really concretize some of those details with other facilities, we will be communicating to the public as to where they can go for other services.
Authorities are still assessing the full cost of the damage.
As you said, when Minister Mkhize went there, he was given a figure of 40 million. Obviously now we are still awaiting a full assessment to determine the damage caused by the fire.
Though the smoke has cleared, it has ignited more questions than answers.
I don't want to get involved into the issues of the fire hydrants and so on. We are glad that finally the fire was extinguished. The Joburg Fire Department, assisted by Ekurhuleni and other municipalities, were able to battle that fire until they extinguished it.
A place of safety almost turning into a death sentence. It's a matter of serious concern.
We do everything to ensure that the patients are safe. And that is why even in the event of fire, we were able to move them to safety. So we'll continue to do everything to ensure that the patients are indeed safe in that hospital and any other public hospital.
From the Bank of Lisbon tragedy to the Charlotte Maxeke inferno, last week could have been more deadly.
If anybody is found to be at fault, we will have to take appropriate action.
Operations are expected to resume early May.
As we know, the bigger part of the hospital was not damaged by fire, so that part will reopen. We will start moving the patients back during the 1st and the 2nd of May, and by the 3rd of May we will resume most services of the hospital.
Investigations are still underway. Maageketla Mohlabe, SABC News, Johannesburg.